Young children can develop Sunday involved in Gambia national mental health group, which started this year. We have some technical issues, but we can now get on the program. We're going to introduce the DG of the Gambia National Library, and he's going to introduce himself and say a few words. Thank you.
Good afternoon, everybody. Before all the welcoming remarks, can I kindly beg your indulgence for us to start with silent prayers? Thank you very much. On behalf of our colleagues, Jorr and team, Uncle Mom that are here, and then Amran, Gaye, and all those that are out there, we want to express our sincere gratitude for the opportunity. We also welcome you here. This is a very rare occasion. Libraries are also very important centers. Libraries are very important centers for this kind of deliberations. I won't go into the nitty-gritties, but I equally want to believe mental health should be a human rights issue. We would leave that for the experts to delve into. And then without much ado, I want to say you are most welcome and feel free, and we hope to have a very engaging and interactive session. Thank you very much. I'll also hand over the microphone to you.
Thank you very much, Mr. DG. Good afternoon, everybody. Good afternoon to my, my big brother and friend, Selmo, and of course to everybody here. Um, Now, of course, we wanted to start at sharp over. Unfortunately, we don't have to get to everybody from 2 minutes before we can start. Now, obviously, we all know why we're here. Um, it's as the video said, mental health was a serious problem, and it's important we felt to at least start from dialogue here in regards to what it's all about. We have some experts, of course, both among you and in now, without much ado, I'll just have over to actually give an overview of the mental health. Over to you, Amran.
Hello?
Can you hear me?
No, I can
Yes,
hear
please
you.
go ahead.
I've been sending messages. I think they need to bring the
Oh,
mic closer or something.
okay, go ahead.
Okay, can you hear me?
Hold on. Yes, yes.
Hello? Can you hear me? Oh,
Please go ahead.
hello?
Okay, go ahead.
Okay. Welcome everyone. I hope you can all hear me in the audience. So thank you for coming. I know it's middle of the week and it's busy. Everyone's busy. So thank you for taking time off to come. So I won't speak much. I think I have like 5 minutes. So I'll try to keep it short so we can keep it moving. We have a lot of interesting presentations and information coming up. And of course, we hope that you can jump into the town hall and ask questions too. So my name's Amran Gaye. I'm a Gambian computer scientist and writer. I have bipolar 2 disorder. I wrote about it last year, and the positive response was overwhelming and was really encouraging. So I see myself as someone who was privileged enough to be outside of the country to get the treatment I needed. But for every one of me, there's like 1,000 people in Gambia who are suffering but don't get the help they need. So I feel that I should use my privilege to give back. And that was the genesis of this whole mental health idea. And then once it came up, I reached out to Jorr and Rabi, and they were both immediately on board, and they jumped in, and we worked together to give you this event today and the rest of the week. So we were both driven by this, like I just said, this duty, this need to give back to our country from the bounties that we have got in our lives. And we also firmly believe, as we keep repeating, that Gambians are not Sohor. They just are not educated. They just don't know, and that's why they behave that way with people living with mental illnesses. But as long as we are sensitizing people, we believe that that can change. So we started this whole event, which lasted for 10 days. Every day we shared something about mental health or neurodiversity or things like that, and we shared sheets and stuff. So we have a pamphlet for you before you leave that contains everything we shared through the week, and we hope it will be useful to you and that you'll share it with other people. Now, basically, what we're trying to do, in my own case, it went to a very dark place. I went to a very dark place, but I was saved because the people who love me, like they built me this net that just supports me. They're not psychiatrists or whatever, but they're kind. They listen to me. They forgive me when I act up. So I feel like other Gambians with mental illness are lacking that, because you need the care of your loved ones just as you need like therapy and meds and all of that. But we don't really have that in Gambia. Whenever someone has a mental illness, we just call them a tough, and then we just ostracize them from society pretty much. So, as we will show you today, the supposed duff, which we usually call people with psychosis, that's a small fraction of mental illnesses. So, we'll be covering things like postpartum depression, we'll be covering neurodiversity, we'll be covering depression in general, and so on, and trauma, and so on. So, what we want you to get out of this, in conclusion, is to not just be educated, but to leave this place and go out and educate other people. So that way we can start a ripple effect until we get to a point where all Gambians have heard about these illnesses and understand them. So, over the course of this event, we'll be playing some PSAs, some videos that we made, some short videos explaining different mental health concepts. So you can watch those as the event carries on. Now, so I'll stop there. Like I said, I have 5 minutes. But just a final note of thanks. So obviously, Rabi and Jorr, none of this would be possible without them. Like Jor's on the ground, she ran everything logistically. Rabi's online, and she did all the videos and everything. We wanna thank Uncle Mom as well. He's always available for any kind of program that we have. He's always willing to give his time and support us and advise us. So we appreciate that. And then we have Musu Media and Alcamba Times, who are our streaming partners, who are the ones who are putting it online. And of course, the Gambian National Library with Bakari, who's always available. So I think I probably hit 4.5 minutes or something. So I'll just stop here and give it back to Chair. And of course, I'm available during that town hall to answer any questions regarding my experience. All right. Thank you.
All right, thank you very much, Amran. Now, I'll hand over to Jorr, who will be explaining the hybrid format we want to use. And then that will be followed by Rabia, who will give an outline structure of the event, and also, of course, she will be inviting the person who's going to do the testimonial, etc. So over to you, Jorr.
Thank, thank you very much, Uncle Mom. So the aim of this was to try and get as many people involved as possible. Hence the reason was decided to have not only a live event where people can attend, but we also have an event where we're streaming it. So the way it's going to work is we are available for questions and answers as we have professionals in place. So if you do have any questions, please do send them in. One of our professionals or one of us, the little we know about it, we might be able to assist. And then shortly after, we will be having the food people sharing um, their experiences about mental health. So I'll pass it over to Rabia to also talk a little bit about her role today.
Thank you, everyone. It's good to see the numbers are rising online, and I can't tell how many people are there in person, but just saying thank you for coming today. So I am a mental health first aider. It means that professionally, I cannot diagnose or let's say help somebody in a professional capacity, but I have been trained at least to approach, assess, and assist with crisis, to listen and communicate non-judgmentally, to give support, to signpost information, and so on, and to encourage appropriate professional help. So basically, I'm just a listening ear. But what I also do is I champion mental health on social media, on TikTok mainly, and also in local languages, just so that people understand how important this is for society because it's a priority for all. Now, the fact that we're having this conversation today around mental health in the Gambia is already a significant step forward. So, just to break down what's going to happen, we'll have a testimonial, we'll have expert reflections, we'll also have a Q&A session, which would be followed by a call to action and so on. But not to drag it any further, to get us started, we have the beautiful Fatu Drame, who's known as Chat Drame, and I'll pass over to her. Chat, are you there? Amran?
Hello?
Yes. Thank you, Fatu. Go on, you have
Hi,
the
good
floor.
afternoon.
Good afternoon.
Sorry, Ravi, I was on mute. We can hear you, chat.
Okay, good, good,
Let me check the
good.
audience. Uncle, mom, can you guys hear too?
Yes.
Okay.
Okay,
All
cool.
right, go ahead.
Hopefully you're not drowned out by the Super Mario in the background.
No, we
I
can
warn
hear you.
you
We can hear you. Yeah.
in advance.
Yeah, go ahead.
Yeah. But thank you guys for this opportunity. It's a good vibe. It's long overdue, I guess, for us to be talking about mental health, especially as Gambians. Um, so yeah, thank you for having me. Very good.
Yeah, sure, Chat. But if you can go into your testimonial, that would really help. If you can tell us mainly why you're
So
here. Hmm.
So basically, I'm here as I won't say as an adult that has grown up um, around quite a lot of mental uh, illness. Uh, it goes back from when my mum, she's a schizophrenic patient, and I've watched her age with that, to the Alzheimer's, to the disconnect that it causes with children, uh, the, the effect of depression that it causes to the people around her. I step in as somebody that can actually discuss those things finally. And I know a lot of people are going to be like, oh, in Walla, full unyisa sutura and things like that. But there are lots of adolescents and lots of grown-up people I can say that have actually gone through what I've gone through, but because of the society, you can't actually discuss it. It's something that you do hoa. But it's not all trauma. That's something that I want people to understand. Um, it's not all trauma. You have times where you're thankful, um, and it's the little things. It's days where your parent will run on a sports day. You treasure those memories. Um, it's not all trauma. So those are the things I'm here to explain to people that are watching, and also answer any questions that you guys might have. Yeah.
All right, thank you very much, Chat. Quite I'll leave the feedback for afterwards for how we feel about that. But at
Hmm.
this point, just encouraging everyone whilst you're watching, please type in your questions and we'll have a portion where you'll be able to also just give us your questions in audio format as well. But Jorr, I'm passing back to you.
We can hear you, Jorr.
Just
Sorry about that, guys. Can you all hear me?
Yes, we can hear
You
you,
got
Jorr.
yeah?
Yeah, we can
Sorry.
hear you.
So next in the program, we've got a psychologist in place who's going to give us a bit more information about mental health and obviously just give us a bit more information about it. So is Kieran ready?
She's on the ground with you.
she needs to be here.
Um, um, Good afternoon, everyone. My name is Karen Parani, and I'm a psychologist practicing in the Gambia. It's a pleasure to be here, gathered amongst the people that acknowledge and support mental health in the country. Gambia has been home for not too long for me, but the mental health issues here seem personal because the potential and the help is very easily visible and understood, but not accessible to the general population. Majority of the prevalence is seen in the form of depression, anxiety, substance use and abuse, and psychosis and epilepsy. The children of Gambia are also not left behind in their struggles with neurodivergent issues such as ADHD, autism, dyslexia, and also the most recent epidemic of substance abuse in the younger population. However, due to lack of awareness, accessible treatment, and stigma, we are far behind in our efforts to improve mental health, but we are still on our way. Younger people are reaching out, they are trying to get help, they are bringing their parents and children, and they are getting their concerns addressed and solved. Just like the saying goes, better late than never, at least we are getting there. Events like these help us reach more people out there that are looking for the proof that there are people here that will understand them and help them. And I encourage them to reach out more, to share their experiences and get their help. They all deserve it. I think the people of Gambia deserve it. Thank you very much.
Hello?
Jorr, Jorr.
Yeah.
Sorry, guys. Can you all hear me?
Yeah, go on, Jorr.
Yeah.
Yeah,
Okay.
sure.
So this wasn't actually supposed to be. This wasn't on the agenda, but since I'm hosting it, I thought I might as well share my testimonial with mental health. So the reason why I kind of connected with Amran is obviously due to mental health, and that is because it's something that is very close to my heart and something that means a lot. Not only have I suffered from it, but I've also had family members that have suffered from it and that are still suffering from it. Now, the whole point of this forum is to try and remove the stigma we have against mental health in the Gambia. Mental Mental health, though it is not visible, it is still an illness, and we should be supporting people with illnesses like this. Just because you can't see it or you can't feel it, that doesn't mean that it doesn't exist. Now, there are various different types of it. Personally, I suffer from depression and did for a number of years, but luckily for me, I was able to get the help and support that I needed at the time when I was in the UK. So the whole aim of this program is let's talk about it, let's discuss it, let's get the help that we need, and let's start normalizing it. Now, yes, you might have a headache or you might have a broken leg, and it's quite visible for everyone to see. But something like depression is also quite serious because it can kind of take you into dark places, stop you from sleeping, from eating, and living an everyday life. So, so yeah, and I think to kind of summarize it all, to end it all, I am a testament that there's hope. Now, 3 years ago, if anyone came to me and told me that you probably would be alive in the next 3 years, I would not have believed you because depression had taken me in a really dark spot and a really dark place that I didn't think I was going to come out of. So, so for anyone listening or for anyone watching, please know that there's help and there's hope. And if you truly want to get if you truly want to get out of the dark space that you're in, there is help out there. We will be sharing material later, and we will be sharing contact details of exactly where to get help in the Gambia. Thank you.
Thank you very much, Jorr, for sharing that. Sharing our feelings actually leads to a great connection that creates healing, and it gives others the encouragement to come out and talk about their own battles with mental health. Next, we have Mr. Sharif Jallo. He is a mental health UK professional. Sharif, you have the floor. Okay.
Thank you, Rabia. My name is Sharif Jallo. I'm a senior mental health practitioner. I've practiced mental health for about a decade now. I've worked in various settings, on wards in the community, psychiatric wards, prison services as well. Mental health is very subjective. Everybody experiences it in a different way. They might have similar symptoms, but it's all experienced in a very different way. I think everyone that has spoken so far has mentioned some sort of a support system, a social network that they have that has supported them in getting better. And in terms of recovery, sustaining recovery, you need to have a social network. And unfortunately, in the Gambia, I think that's lacking because of the stigma attached to mental health. Over the years, I'm sure that most of us have seen somebody walking on the streets in Gambia, no shoes on, shirtless, or perhaps even naked. And one must wonder, where are their family members? Where's this person's brother? Where's this person's sister? Where are their parents? And I can guarantee you that it's because of the stigma that's attached to mental health that these people are left on their own. And unfortunately, in terms of mental health, where there's no immediate early intervention, it just makes things worse for that individual. The suffering is prolonged. So in terms of mental health, the sooner you intervene into any mental health diagnosis, the sooner you'll have some sort of a recovery. Now, unfortunately, sometimes there might not be a full recovery. It might be about management. Amran, I'm sure you can testify to this. Sometimes medication, therapy, it's about managing the symptoms. Okay. Sometimes you have issues where there's a lack of resilience, and it might be because you're going through a certain difficulties in your life. It could be financial, it could be a divorce, it could be a bereavement. We're all human and we all respond to trauma in our own individual ways. But having that support system in place, it's vital. Now, I understand that in the Gambia at the moment we have one psychiatric hospital, Tanka. If I am wrong, please rectify me at some point. And I understand that they're overburdened. They lack the capacity to see most of the of Gambians that are suffering from mental health problems in the Gambia. And I'm aware that now, I think the highest diagnosis in the Gambia at the moment is schizophrenia, um, followed by psychotic presentations, i.e., drug-induced psychosis. And over the last 5 years, I understand that there's been an extreme rise in the cases of young women and men that have unfortunately experienced drug-induced psychosis because of the substances in our streets in the Gambia at the moment. In terms of infrastructure, again, I understand that it's severely lacking in the Gambia. Um, the last I read, I think it was back in 2007, and there was a community mental health team in the Gambia, i.e., mental health professionals that actually go into the provinces, the rural areas, and actually go and visit people. That is the most effective means of treating people and seeing people in a developing country. And unfortunately, we don't really have as much of an infrastructure where we have one or two community-based mental health services in the Gambia, and that's what's needed. It's severely needed. The funding is quite. It needs a lot of money essentially to do stuff like that. But if Gambians come together and realize that it is about a social network, things will generally get better. But unfortunately, that is lacking at the moment. So it's about coming together. Amran, you wrote a beautiful piece that you shared with me yesterday or day before yesterday about your experiences. And again, you highlighted having a social network. It is so important having a social network. I mean, it is so important in terms of treatment and just recovery and just sustaining that peace of mind. When one is when you're unwell, it's that you become detached from reality. You become detached from your family and friends. And those family and friends are the ones that can kind of pull you back and say, hey, look, you know what? Something's not right. Something's wrong. I think you need to do something about this. If you are left to your own devices, you will not seek that help because you don't have the insight to actually say, you know what, something's not right. Let me go and look for help. Unless it's something like depression, perhaps. And that's just the initial stages. But later on, with depression, again, you become quite disconnected. You disengage from your friends and family. And once you're left alone, it's extremely difficult for you to come back, to where you were before. So again, if I just to highlight that a social network, it's so important in terms of getting better and just having a fulfilled life. I'm happy to answer questions about mental health, about symptoms. At some point in my life, I experienced depression as well. This is about 15 years ago. I was going through a divorce and I hadn't seen my children in quite a while. And that actually pushed me into mental health. I mean, I went to look for help, and then I thought, you know what, this is something that I want to do. I enjoy speaking to people. I think over the years, I've assessed more than 1,000 patients over the years of different backgrounds, different colors. We more or less all the same, but once again, mental health is subjective. And the majority of the people that I saw that actually recovered and that are doing well today, it's because of their social network, family and friends. So just to say that it is extremely important to have that social network. Thank you.
Thank you.
Thank you, Mr. Jallo, for volunteering and offering your expertise. We appreciate the fact that we have you here today. Amran, I'm not too sure which of the streams you're on, if we have any questions coming in at this point.
Okay, yeah, I'm looking at YouTube, so I'll pass on anything I see there.
All right, then. Jorr, do you have any questions from there?
No, we don't have any questions as of yet. I was thinking maybe we could share with the audience the videos that we've done throughout the week, just so that they can see the work that we're doing. Yeah?
All right.
Yeah, sounds good. We're waiting for Osh to play. Okay. Hello, Joe. You're frozen. Can she hear us?
Some people's brains work differently. That's not a flaw, it's a fact of life. Autism, ADHD, learning differences, these are not illnesses, they are ways of being. Neurodivergent people may struggle with school, focus, noise, or social rules. They may learn differently or move differently, but they have strengths too. Creativity, honesty, deep focus. What they need is understanding, not labels, not shame, not punishment. Let's stop asking them to change. Let's start changing how we treat them. Inclusion means making space for every kind of mind because every brain matters.
Thank you, Ravi. I have something.
Yeah, go ahead, Amran.
Okay, the first question is from Mam Kuma Sose. So she's asking, how does one develop a social network if they've been ostracized by their family and friends? So Dr. Sherif, that might be yours.
Amran, just to say that I'm not a doctor. I'm not a medical doctor.
Yes, definitely.
Just
Yeah.
um. So, and what was the name of the lady who sent this message?
Mam Kuma Sose.
Okay. So, yeah, I mean that's a difficult one. That is a difficult one, and I think it's a cultural thing in most developing countries. It's not just in Africa; it's in Asia as well. Where this cultural belief that somebody's doing something to you, it's dark magic. It's I don't know, someone's taking you to Marabu. Uh, um, I mean, that concept is the reason why there's this stigma attached to mental health. Um, I think at some point early on in the illness, if a person has insight into the illness and is able to actually approach a friend, a relative, and say, "Look, these are my experiences, and I know it's not normal. I really need some help." I think that's the only way to combat this. That the sooner you actually address the situation and approach friends and family, when they can still to relate to what you're saying and you're still able to communicate your experiences, I think that makes it a lot easier. But when it gets to the point where you've actually gone beyond, when you've lost your touch, your grasp on reality, and you're not able to communicate as effectively to your loved ones, I think that's when they say, well, Amadou, this is not Amadou. This is not my Amadou. My Amadou has changed. My Amadou wouldn't say this. My Amadou wouldn't behave that way. That's where the issue is. With most mental health illnesses, at some point, our personality changes. We're not aware of it, but everybody else around us is. So it's being mindful and actually being pragmatic and saying, yes, you know what, something is wrong. Let me take those first steps and go and speak to somebody. It's extremely important to take those first steps and speak to somebody about your experiences. It doesn't matter how small they are. Once you realize that something is happening, you may be having suicidal thoughts about not wanting to be here anymore. You may be experiencing thoughts, just derogatory thoughts about yourself. I'm not worth it. Nobody cares about me. Nobody loves me. And those are some of the thoughts that you have when you have depression. But bear in mind, with depression, clinical depression is a period of sadness, a lack of satisfaction, no joy, but it has to be over 3 months. It's 3 months and over is defined as clinical depression. Sadness is generally, a lot less than that. So but you know what? Even when you're going through a hard time, when you feel you're feeling low, you still need to approach someone and speak to somebody. So get that help before you become disconnected with your friends and family. Basically, that's the way forward. Yeah.
Thank you. Ravi, I have
Thank-
more questions.
All right, yeah, go ahead.
Okay, and just to add to what Doctor said, sorry, Mr. Sherif said, yeah, that's what worked for me too. Just talking to people, just find people you really trust, people who will judge you, even if they don't understand. As soon as you explain, even their language, I found that with my friends when they
Yeah.
use something, that I feel like, so I just tell them and they stop using. So you might be surprised. Just try out your friends, your parents, and just explain.
I mean, it doesn't have to be family, like you said. It can be your friend.
Exactly.
I mean,
Exactly.
whoever you have that connection with.
Yeah. Yeah.
Yeah,
So
yeah.
yeah. Okay, so then going Jeng, she said, well, Emily drew first. So she said if we have any mental health resources to check later. So for that, we have our website. We've shared it on the page and we'll share it here as well. So you guys can go straight there and we have pages full of material. This one is for chat. I don't know if she's still on.
Todd, are you around?
Okay, because Ndenguni is asking, that is saying that she would like to know if, oh, I think she's talking about Dr. Kiran, not chat. So she's asking if she provides therapy services and how to reach her. So I think we can put that on our website as well, right?
Mm-hmm.
Yeah, okay. And then if she has a number or something, she can give it to us, and Alkama Times will display it.
All right.
Yeah, I think
Uh,
that's all I have.
Someone just sent me a private question. I'm not sure who can answer this, but they're asking what is the difference between schizophrenia and psychosis? Can someone elaborate on that? The difference between schizophrenia and psychosis?
Yeah, I'll be happy to answer that.
Yes,
Mm-hmm.
please. Yeah.
Yeah. So schizophrenia, it's a long-term diagnosis. It's not something that is diagnosed immediately. So we have a term that we refer to as first episode of psychosis. So that's basically where you gain certain symptoms. Symptoms, i.e., you're hearing voices, or sometimes it's not even a voice. Sometimes it could just be noises. That's what we have, tactile hallucinations, where you feel certain things but that are not there. I mean, some people feel that they have spiders crawling on their arms, or they think that they have an infestation of worms in their skin. That's normally associated with drug-induced psychosis. Psychosis is generally the first experience that you might have. We refer to it as psychosis. And then when we have done quite a number of assessments, we would generally say, you know what, all of the symptoms that that you're presenting with generally fall within the criteria of schizophrenia. Okay. In terms of diagnosis, you'll also look at family members. The questions you'll be asked is, do you have any family members with a history of psychosis in your family, of mental health illness in your family? The reason being, the more likely you have somebody in the family that has a history of mental health illness, the more likely you are. I'm not saying that you will, but more than the percentage is quite high that you might develop it at some point in your life as well. But essentially, again, to answer the question, schizophrenia is a long-term illness. It's something that you have over many, many years. And psychosis is something that can be managed, it's something that can be cured, depending on the current stressor. It could be drugs, or it could be just social economic factors at the time. But it is treatable. Schizophrenia, unfortunately, is managed. It's a long-term condition that's managed.
Mm-hmm.
Yeah, I hope that helps.
Thank you,
Ravi,
Mr. Jala.
one more for Mr. Jallo. I got it privately. Can I go ahead?
Yeah, sure.
Okay, she says, I hopped on late, but can Mr. Jallo talk about postpartum depression, which seems to be on the rise in Gambia?
Yes. Yeah. So I have had a few friends who have had the same experiences. So a postnatal depression. It's very common. It's very common. Initially, from the time a woman becomes pregnant, your hormones are changing all the time. It's a lot like a woman who goes through menopause. But anyway, that's a different story. So with postnatal depression, it's your hormones essentially that have changed during childbirth. Your body is going through changes to adequately prepare for carrying a child for 9 months, and then the breastfeeding and all of that. Your body is getting ready for you having a child. Once you've had the child, unfortunately, sometimes the hormones stay the same. There's a bit of haywire going on. They don't return back to normal as quickly as they should, and that's when you have these symptoms, these postnatal depression symptoms. You may develop anxiety. You have, I think I mentioned it before, you have these derogatory thoughts about yourself. I'm not worth it. Nobody loves me. I'm not good enough. You start having all of these negative thoughts. And unfortunately, when you don't have the appropriate social network, it could be your husband, who, in the Gambia, yo, no joke, get up, go have a shower, go do something, not realizing that you don't have You don't have the energy for one. You don't have the motivation for two. Secondly, sorry, and you're just lacking the satisfaction in anything. You don't enjoy anything. That's the main problem. That's what most people tell me when they say they postnatal depression. That's mostly what you get. I think the most concerning thing is being unable to bond with your child as well, and that makes it even worse. Okay, when a mother has a child and the mother's thinking, "I'm not good enough. I'm not a good mother," there's these feelings of guilt, which makes it even worse. In terms of treatment with postnatal depression, it's more about having a discussion about how you feel. It's about engaging in therapy. With mental health illness, it's not always about medication. Sometimes it's just about talking and about how you're feeling. And once you realize that there's other people out there who are going through the same experiences you are, it's, you realize that, what, it's okay for me to feel this way. Having that understanding, it's the hormones. At some point, it will dissipate and I will get better. But I need to talk about this, There are antidepressants out there that you can have when you're breastfeeding. There's sertraline. There's quite a few safe antidepressants that you can have when you're breastfeeding. You can talk to a mental health professional about medication, particularly if you're having suicidal thoughts. Then you really need to consider taking some kind of medication so that you feel better a lot quicker. Medication generally takes about, it depends on the individual, but it normally takes about a month to 2 to 3 months for it to work. But again, it depends on the medication you're taking. But again, postnatal depression is very common, but it's about finding someone that you can speak to, again, a mental health professional that you can talk to about your symptoms and why you're feeling the way you're feeling. Yeah.
Thank you very much for clearing that up. We have a question for Dr. Kiran. Jorr, are you able to pass the mic?
Yeah, I'll just pass the mic. Just 1 second.
If she can come up too, so we can see her.
Hi, Dr. Kiran. It's 2 questions, but I'll mesh them into one. The person wants to remain anonymous, but they said, my cousin uses drugs. There's a lot of drug use in Banjul. Does drug abuse lead to mental health problems, or is it mental health problems that lead to drug abuse? Can you hear that?
Can you guys hear us?
Yes. Yeah.
So is it drug abuse that leads to mental health problems, or is it mental health problems that lead to drug abuse?
I'm sorry, but your question, you couldn't hear it. There was an internet issue, so could you please repeat it?
I can't hear too
Yeah,
well.
I can hear too well.
But if you can hear me, someone's asking, they said that their cousin uses drugs and that there's a lot of drug use in Banjul. So does drug abuse lead to mental health problems, or is it mental health problems that lead to drug abuse?
Thank you for your question. What happens is that it's a loop in a way. Drug abuse can lead to mental health issues, for sure. Just like how Professor Jallo said, that if you do have a high intake of drugs, it can lead to drug-induced psychosis. It can lead to many other issues, right? But at the same time, what happens is people that do go through mental health issues end up resorting to drugs to feel better, drugs and alcohol. So what happens is that depending on what drug they're taking, it kind of gives them a release from the symptoms that they're experiencing and suffering from. And so what happens is that it can be both. So there are people that are taking drugs and they're suffering from the repercussions of it through psychosis, depression, anxiety, because sometimes, with let's say, for example, if you do take weed, the symptoms or the after effects of weed can be various for every other person. For some people, it relaxes them. For some people, because of the things that they're experiencing, they end up getting anxious. Also for LSD, MD, there are so many drugs out there. So it depends on how everybody experiences it and the kind of results that end up happening with them. The same way, people that are going through mental health issues end up looking for drugs, but end up having, counteractive effects. So it's kind of like it goes both ways.
Okay. So, Amran, did you lose the sound?
No, I think she was just delayed. Can you hear us? Jorr? Okay, continue, Rabi.
She,
I
yeah,
have some more
she's saying
questions.
that it's basically what from what I could conclude, she was saying that they are linked. You can have
Okay.
mental health can cause you to use drugs, or drug abuse itself could also cause you to have mental health problems. But there's a question here about the Gambia as well. This one says, I have a family member we feel is suffering from acute depression. Do you know any places they can go for any counseling services in the Gambia? So, someone has a family member who's suffering from acute depression, and they're asking if we know of any places that they could go to for counseling services in the Gambia.
Yes, there are a few here now that are actually taking such and such. So I'm one of them. I also do see clients in the Gambia that are going through depression, anxiety, eating disorders, and OCD, and just general mental health issues. There are other organizations as well. I think Amran has them on the website, so they can take a look and see whichever one suits their needs and then get in touch with them.
Okay. Thank you. Mr. Sheriff wants to comment as well about the drug abuse and mental health, which was asked previously.
Yes, about the substances, it's a double-edged sword. Substances can actually lead to psychosis, and a lot of times people that have got mental health problems will actually self-medicate. They use these substances because it makes them feel better to a certain extent. But then, unfortunately, what it leads to is dependency on certain substances. Now,
Mhm.
we have these neurotransmitters in our brains. Scientifically, dopamine. Dopamine, it's responsible for feeling, seeing, smelling, touch, hearing. Now, what happens is when you consume certain substances, certain drugs, i.e., marijuana, what happens is your dopamine levels go higher, and then what happens is you start hearing things that are not actually there. You start seeing things that are not actually there. You start feeling things that are not actually there. So that's the effect that substances, drugs can have on your dopamine neurotransmitter. They start sending messages that are not really there. So that's when you develop the hallucinations. So unfortunately, it's not everybody, but it's like playing Russian roulette. Some people can smoke cannabis for all their lives and not have any problems at all, and somebody can smoke it once or twice and they can experience a psychotic episode.
Mhm.
So I think I am geared towards saying yes. Drugs can cause mental health problems. People do use them because it gives them some relief, but eventually, I think there's negative consequences to using substances. So yeah, I'd say you stay away from them if you can.
Yes, definitely.
Rabi, I have a private one.
All right, go ahead.
Okay, this one is from Mr. Sola Mahoney. Thanks for tuning in. She says he says, sorry, there's some important focus on how best to respond when you or we are going through these symptoms. But what about those of us who might observe symptoms or behavior of mental illness in our relatives or friends? What's the best way to handle that? How does one go about getting help for friends or relatives who have not recognized the symptoms themselves?
Mhm.
I think both of you can go,
Yeah,
Mr. Sharif.
Dr. Kira and
Yeah.
Mr. Sheriff, anyone?
I think initially,
Sorry, I missed the question.
Oh, basically, he's asking if what to do when it's your friends or loved ones who are suffering from mental illness, and also if they haven't admitted it to themselves yet. Did you hear us?
Uh,
They know that they have they're suffering from it, but they haven't sort of accepted the fact that they've got it.
Yeah, and how to help
I
them.
think that is a very good situation to be in because they are suffering from symptoms that are difficult to handle, some things that they do not understand, and so it's a very tough spot to be in if you are experiencing symptoms of mental health problems that you can't really accept it. I think speaking with your close ones about your difficulties that will actually listen non-judgmentally and provide some kind of support helps because then what happens is that they're able to direct you towards the right kind of help, provided that they themselves are also equipped with the knowledge. But even if they are not, I feel like sometimes they have just a listening ear or just comforting words that can sometimes help us deal with our problems much more easily and then lead us towards the safety net of actually accepting that we have a problem. But getting help for mental health issues starts with first speaking about the issues that we have. And the right people who hear it, the right people will direct you towards the help you need. But yeah, the starting point has to be actually sharing it first with people around you that you trust and will hear you out.
Thank you, Dr. Sheriff. Yeah, maybe you're about to be a doctor
I
and
think
be
so.
I
predicting.
think I might as well just go ahead and do that,
There
Amran.
you
You
go.
know.
Just get a
Yeah. Right after
PhD.
this, yeah.
So
Yeah, go ahead. Yeah.
yeah, I mean, it's you know what, it's I think it's extremely challenging when you have a loved one who is experiencing these things, or even a friend. Your approach is extremely challenging, especially if that individual doesn't have insight. They're not aware that they are unwell, and that's one of the most difficult things. Even when it comes to treatment, if a patient does not realize that they have a mental health illness, it's extremely difficult to treat them because why would I take medication if I'm not mentally unwell? That's their perception. The initial approach is one with empathy. It's one where it's you're not non-judgmental. You know, um, it's just you're treading extremely carefully when you're telling somebody that what, Amadou. Over the last few months, I've noticed that there's been a change in you and your behavior. Can I ask, is something wrong? Are you going through something right now? Do you want to have that discussion with me? You know, it's not about you and how their behavior makes you feel. It's about them and what they might be going through. Yeah, it's about asking them what are they going through. Is there anything I can do to support you? That's the approach. The approach is not judgmental. It's not about you making me feel uncomfortable. It's about my friend, my brother, my sister. I've noticed something's wrong, and you're not yourself. Is there something wrong? Is there something that I can do to help to make things better? That's the approach. It's not what's the word? Do haste. It's being non-judgmental. It's being caring and being loving. Essentially, that's the approach.
Uh, Thank you, Dr. Jallo. It falls with the theme of, oh yeah, I gave you the doctor again, but it falls with the theme of the mental health awareness slogan this year of it being all about community, how together, with the help of everyone, we can all heal. I have this other private question before we get into, I think we have
And
people in
then,
the chat.
Ravi, just a quick reminder. Someone had a question for chat earlier, so
Oh,
we can
yes.
come back to that later. Yeah.
All right, so let me just get this one quickly. It says, what is being done for non-educated or non-English speakers in the Gambia that are going through mental health problems? What is being done for non-educated or non-English speakers in the Gambia that are going through mental health problems? Do we have anyone who can answer that?
That's an extremely difficult one. Wow, that's extremely difficult. So, in the UK, you practice and you see quite a few different nationalities. Um, what makes it easy for us is that we have a language line. We have a dedicated telephone line that's run by various people from various countries. So they speak different languages. So you can call that number and say, look, I have a patient who's experiencing this. This is the language they speak. Do you have an interpreter that speaks that language? And they'll have someone for you. In Gambia, as far as I'm aware, I don't think there's anything like that in Gambia. Um, you'd probably have to, I don't know, find somebody that speaks the same language, which probably wouldn't be an easy feat at all to do. So that's a
Right.
challenge. That's a challenge.
So we do have some practitioners here that actually do speak the local languages. Like for example, Dr. Namin Siriwe, he is the oldest psychologist in town, and he's the main leader of the whole field in the country. I work very closely with him, so I know that he is seeing patients that do speak English and do not speak English as well. So there are people around. Unfortunately, there are not many, but there are people around that are speaking the local languages. The only psychologist I know is Dr. Siribe, but the others that are around are more psychiatric nurses that are still under training and getting there, but they're all quite busy in Taka Taka. But regardless, they are there. So even if they do get in touch with anyone who can actually speak the language, there are translators around. There's help available. So it's not like the local Gambian cannot get help in their own country, because that would be very sad if it actually was like that. But no, there are practitioners around. It's just very hard to find them, but they're there. They're there for sure.
Okay, that's good to know. But at least
Okay,
they're there.
Rabi, I just saw your message. Chad, basically, they were asking, how do you deal as a person living with someone with mental illness?
Okay, I think to answer that, my history with my mum has gone far back as before I was even born. Um, and like I said before, you have good days and you have bad days. You never know what to expect. But the one thing that you need to understand is sometimes stay over. Sometimes you need to understand that more definitely it's not done on purpose. So you have to have a break. You like self care to care for somebody. You need to first care for yourself. It's something that I've actually learned very late, like literally very late. Because she's aged now, I understand that I need to take care of me, and it's no longer me and her. It's me and my family and her. So we're a unit, and that's my squad. And for me to be able to process and handle the daily activities I have to do, and also care for her, I need to care for myself. But she comes first all the time, because you you don't know what signals you have to read into. It's beyond verbal. Sometimes you know that the silence is not that she's at peace. It means that she's probably going through some mental trauma. It's like sorry, you're not a doctor. I almost called you doctor.
Just call him doctor. He's
it's
a
like
doctor
He's
it's
today.
like
doctor
it's
from
like the
today.
disconnect that was discussed before. When you're caring for somebody, especially with somebody with mental illness, you have to understand that there's a very thin line between you getting overwhelmed, burnt out, depressed, or disconnected, which is basically you're living a life around the person and not living for yourself. So you have to make sure that you take moments away for yourself and the things that you love. And this is why most of the people that do care, I've realized recently, where we've all gone into things that deals with creating, like writing. Sorry,
Oh, that's
that
fine.
deals
It's
with
for little ones.
writing, that deals with painting, that deals with drawing, because that's an escape for most of us. So basically, that's how I deal with what I deal with. I need to take the time to find a space that I care for myself before I can care for her. Sorry.
That's okay.
No, absolutely. I mean, what you're saying is, as carers of people with mental health problems, we need carers too. We need a social network as well. You know, sometimes we need that respite. Sometimes, I mean, you have your mother 24/7, and it can have an impact on your mental health as well if you don't get a break once in a while. Now, unfortunately, what might happen is, chat, you might start becoming guilty when you start thinking, "Oh my God, I need a break from this.
Oh, it's
This is becoming
happened.
okay."
It's happened.
So,
It's
so
happened
that's
more than once.
exactly.
And sadly enough, within our society, it's like you can't say that you're overwhelmed to look after your parents,
Yeah,
and
yeah,
that's what we're living with. You can't
yes,
say, you dare not, but
yeah,
it can be a lot, especially when you start having your own family.
yeah, yeah.
Yeah.
And you talked about looking after yourself, and you need to look after yourself, and you need to speak
Hmm.
up and say, "Look, this is a little bit too much for me. I
Of
love
course.
my mother, I love my father, whoever it is that you're looking after, but it's having an impact on me. And
Of course.
unfortunately, if I have a mental health problem, then I can't effectively look after my family either."
Yeah, and
Yeah,
it's really difficult to,
yeah,
like you said, it's there's a thin line between being disconnected and living the life that isn't yours and
yeah,
depression. So sometimes you don't actually have depression, but you're just so down because you're living a life that you know is genuinely not yours.
yeah, yeah. Yeah, so again, it's about trying to create that social network. I mean, if you have siblings, then you take it in turns. Your younger brother, older brother has your mother for a while, whether it's a week or a few days, just to give you that
Of
breathing
course.
space so you can have some respite.
Hmm.
Yeah, and again,
Hmm.
it boils down to having that social network. So a social network isn't just for the person that has mental health problems, but it's for the people that are caring for those people that have mental health problems as well.
True.
Yeah.
Mhm.
There's something in the comment box, Ravi.
Um, is it the one from Moniku Baji or is it Princess B?
Oh, well, I'm looking at Monica, but we can do Princess too, because Monica
Okay,
is providing
yeah,
something.
an answer. Yeah. So Princess B says, "Hi, what is the process of getting an assessment and a formal mental health diagnosis in the Gambia?" So I repeat that. What is the process of getting an assessment and a formal mental health diagnosis in the Gambia?
And Rabi, I think Monica was answering to that.
Yes, he did say for those asking questions with regards to how they can get help for mental health assessment or treatment, they can kindly visit Canifing General Hospital or Polyclinic Banjul or contact the International Voluntary Mental Health Organization, IVMHO. So he is just saying go to the Canifing General Hospital or go to Polyclinic in Banjul or visit the check out IVMHO. That's the answer he has given. But if Dr. Kiran wants to add anything else to it,
Um, Okay. These are the public places that they can go to, the public hospitals. But other than that, they can see private practitioners as well. Um, the people I've spoken to in the Gambia have not really said the best things about Carifing General Hospital or Polyclinic because usually I think there are only psychiatric nurses around or general nurses around that usually take assessments for mental health. But if there is no access to a private practitioner, then these ones are good enough for starters, yes.
okay. Uh, Amran?
Yeah, that's it for me. But I think we can do some more videos.
Hmm. Sure. Dor?
Sorry, if you guys can hear me just before we go ahead with the videos, I've got a couple
Hmm.
of people on the ground that have got some questions that they would like
Oh,
to
okay.
ask.
Yeah, yeah, yeah. Let's do that.
That would
Yeah.
be great.
Before we even get on that question, sorry, I need to go back onto the local languages. I had a representative of Canada approach me to advise that you can get help in all languages. That they do have people that speak Wolof, Mandinka, Serer, and all other local languages. She's dropped a card, so if anyone needs their contact details, we'll be adding it to our website. So I'm just going to pass over the mic to one of the guys here who's got a question.
Okay.
Um, Good afternoon, everyone. I am Vincent Gomez, a representative from HEMDA, the Gambia. HEMDA actually means Help the Mentally Disabled Association, the Gambia. Why the word disabled is we go around to help people with little or no help out on the streets in the Gambia here. So I have a few questions for Mr. Sheriff and Rabia, who I will say I've been looking forward to working with, and Dr. Karen here. We are an association, local-based association, and we look forward to working with professionals like Rabia, Dr. Karen here, and Mr. Sharif. And the question is like, do you people organize capacity building programs for people like us who are based in the Gambia and are willing to help people with mental problems?
So there is an organization over here that I'm working closely with. It's called Peace of Mind. We do hold capacity building programs over there. We do organize them from time to time for people that are working closely with people, mentally disabled people. So we do have programs there, yes, but they are not organized all the time. It happens from time to time, but yes, we do organize those programs.
And on to Mr. Sheriff and Rabia. Do you people have any plans of organizing a capacity building program for people in the Gambia that are willing to help our brothers and sisters who are having mental health issues?
All
Yes,
right.
Come in.
Go on.
yeah, it is something that I've been thinking about for quite a while. Actually, I mentioned this to you, Amran, when I
Yes.
spoke to you. Again, I've been in mental health for over a decade, and I haven't really contributed as to anything in the Gambia, which is really sad, and I'm embarrassed to say that. So Amran and I will be having a discussion about what we possibly. I'm hoping something that we can do jointly. Um, I mean, nowadays, in terms of talking about mental health, in terms of offering assessments, it's easy to do. Everything's online, so we can have face-to-face discussions and probably probably set something up. But please watch this space. I'll have a chat with Amran, and hopefully we can put it out there for all to see. Okay.
Yeah.
Okay.
The same
And
on our. Go ahead.
I was just saying, similar to what Mr. Sharif was just saying, I'm very new to the space of mental health, and I am a first aider, which means that my main role is to listen and to signpost onto professional help. So I haven't done anything formally, but informally, I have been working with different people on the ground when people approach me, and then just getting them the help that they need through the different professionals that I know, such as the OPI Gambia, a few people to Tanka Tanka, and to also Sylvia as well. So, as Mr. Sharif said, or Dr. Sharif, just watch this space. We will be having our conversations in the background and see what we can come up with. But Amran, go.
Yeah, pretty much the same. So we'll work on stuff, and then I'll talk to Doctor Sheriff and see what and see what we can
Not a doctor, but yes.
and see
Today
what
You
he
we
might
can
as
is.
work
well
on.
just do it.
I
Today
know,
he
right?
is.
Yeah,
So
might
At
as
yeah,
this
well.
point,
so
just do it.
Mhm.
so we are going to set up the website as a kind of a center of all the resources that we have, including Kiran's. And then I'll talk to Dr. Sherif and Kiran. And yeah, just walk, just watch our website and our Facebook page. There'll definitely be more stuff that we can work
Okay.
Thank you very much for your questions. I'm going to pass over the mic to someone else in the audience who's got a question for the panel.
Hello, good evening. My name is Daniel. I'm co-founder of an organization that works around issues of women living in mental health issues, but majorly women who go through human rights violations. My first question would be how to deal with vicarious trauma. Because when you're dealing with victims who go through some serious human rights violations, and you also always listening to what they're going through and managing their stress, you tend to activate a lot of trauma. I know we spoke about that just a little bit ago, which is healthcare. If we could just maybe elaborate on that, it would help. I also buttress on what my brother spoke about from Kenya about supporting other people who are working around issues of mental health. This is something that is very essential in the Gambia. I've been working in the transition justice process from 2007 to date, and we understand that there's a lot of victims who are going through human rights violations. Some have been able to speak about their plight during the TRC hearings, but others are just shying away from what they've gone through. One, because people will actually understand that these are things that have happened in the past. Two, some of them are still living in denial of what has happened to them. Three, others are living in fear of the stigma that comes along with what was going through, especially talking about victims of sexual and gender violence, especially women who go through sexual violence. They find it very hard to come out because we've seen some of the brave ones who come out during the TRS's hearing, and we know the backlash that they have. So, what advice would you give to support this kind of victims? But also, I think there's a huge need to be able to support the victims who are going through all of these things. I'm not centralizing it in the movement area, but decentralizing it into the different communities and people like that. I also want to talk about the relapses that people deal with when you're going through mental health issues or when you're taking support for mental health issues because you attend to or you're bound to have relapses when you go through the treatment. How do you deal with that? And also fatigue if you have a social network. Okay, fatigue if you have a social network. Sometimes when you're dealing with friends and family, they tend to get tired listening to the same thing over and over and over again. Sometimes, they might just shun you away. And it's normal. It's normal because, like I said, it's also something that has to do with bipolar trauma as well. So, what are your insights on these things that I've discussed? I know it's a lot, but I wanted to just add these things to the discussions.
Okay.
Looks like it was epic.
I don't think we heard much of that.
Um,
Yeah.
If Joel could help us rephrase.
Specification.
It's asking me specification. The question is
Jorr,
about
can you summarize for us?
how serious capacity building that people talking about.
Yeah, we can move to neurodivergence then as we wait. I think Dr.
Yes, as we wait for that clarification, someone in the stream asked, can we talk a bit more about the disorders such as neurodivergence, autism, and dyslexia? So, Mr. Sharif, do you have anything to add about neurodivergence, autism, and dyslexia? Because as we know, not a lot of people understand this in the Gambia. To them, it's just things like "Hale bi buguta wax dafa leta wax" or "Ki dafa stupid," stuff like that,
yeah.
instead of understanding that these are mental delays and so on.
Yeah, it's about being wired differently. It's about about learning social cues. It's about social awkwardness. It's about feeling comfortable. It's about focus. It's about feeling overwhelmed sometimes. Um, I'll give you an example. For example, for me, for example, um, if I am trying to read a book and I have, one of my kids has a TV in the background playing and my wife is trying to talk to me at the same time, I become extremely overwhelmed. And I just want to run down the street screaming because I just can't handle, it's just too much. What's the word? Too much stimulation.
Mhm.
So we all wire differently. My wife, on the other hand, she can have the TV on, she can be listening to the radio at the same time, and she can be on the phone having a conversation. I don't understand how she does it, but
Multitasking.
well, yes. So maybe that's what I'm not good at. But it's so we all wire differently. In terms
Yes.
of social cues, I mean, some of us, well, some of us don't have any friends. We find it difficult to make friends. We find it difficult to maintain friends. In terms of relationships, we are just socially awkward. And you mentioned delay. Sometimes it is a delay. Sometimes we don't develop and progress at the same rate as other people. It doesn't mean there's anything wrong with us. It just means that sometimes our own development is a bit delayed. you know but at some point, we're hoping at some point, we kind of reach those milestones, and we can actually have a fulfilled life. um it's bearing in mind that people are different. That's what it is. We're all different. We develop differently. We handle things differently as well. Sometimes, unfortunately, these things stay with us throughout our lives. The social awkwardness, um uh the lack of attention. Sometimes it does stay with us. There is medication that we can take, and it kind of helps us regulate these emotions. I think one of the main things with neurodivergence is what we refer to as perhaps the lack of emotional intelligence, or what we refer as dysregulated emotions, where we find it difficult to control our emotions. you know Something minute will upset me and make me want to jump off a building, where somebody else, it's not a big deal at all. It's about understanding why you're having these experiences, and adapting, having that resilience, and being able to live with these things, and kind of adjusting accordingly. So I understand that therapy helps. Therapy does help, but sometimes we can have medication as well. But I think primarily medication is to help with a lot of the emotional dysregulation that we're experiencing. And I think our psychologists will probably be able to touch on that more than I can.
Yes. Dr. Hira?
Yes, I missed most of what you said because of the internet issues. I lost most of what you said. But the idea is that, they experience things and see things in a much more different way than normal kids or normal adults would. And it's important that we have people around us that can actually understand them and diagnose them properly and provide them with the proper needs and the proper care that they need, because if not done well, it can actually kind of mess them up even more. Yeah, these kids with dyslexia, ADHD, autism, it's very difficult to find practitioners in Gambia that are diagnosing them currently. Actually, nobody is diagnosing them. So it is difficult to find people that will guide the parents and the kids in proper, like in the right direction actually. So currently I am seeing kids, and I am going to start diagnosing them. However, because of the lack of guidelines for psychologists over here, it's difficult for psychologists to actually do these kind of diagnoses because there's no backing to protect them in a way. But aside all of that, we do have some practitioners here that are actually helping the kids, giving them a very basic general treatment to treat their sensory needs and things like that. But it's not very big in Gambia. We are still very, very far behind. But we're slowly trying to make facilities for these kids.
Thank you. That's actually good to hear. The provision is being made for children who are suffering from or living with these conditions, should be the actual words. Um, uh, if before, are we playing videos, Amran, or I just
Yes,
have
I
one more
think.
question?
Oh, go ahead. Let's finish the questions.
Yeah,
Can I add, we have a question from the audience.
yeah.
There are four, I'll take two before we can move on. The first question was about the capacity building of first aid for first aid people in sexual and gender based violence in Gambia. That was the question from the audience. The
Hmm.
capacity building for first aiders for sexual and gender based violence.
Did you get that?
I think she read a question. I couldn't quite hear. Can you hear her?
Should I repeat
Gambia
it?
internet.
Yes, please repeat it, please.
Okay, the question was for capacity building for first aid for sexual and gender-based violence.
Can she perhaps elaborate on the question? Can she elaborate on that? Give us a bit more.
Hello, can you hear me now? Can you
Yes,
hear
we
me?
can hear.
Yeah.
Okay, so the question was to enhance support, give capacity building support to first aid caregivers, for example, people dealing with victims of sexual and gender-based violence. For example, disabled people is the first point of entry. How do these people also understand that the people that are coming to give their statements or talk about things that they've gone through may be going through trauma rather than just, how do I say, now just joining them instead. And then going to the hospitals as well. How do you ensure that we can support these people, understand trauma that the victims are dealing with? And I also asked about vicarious trauma. If you could maybe share some insights on that and how to support people that are going through vicarious trauma. I don't think I've asked that.
Mr. Sheriff, did you hear?
No, no, no.
No. Ravi, did you hear? And you just
I only
spoke.
heard the bit about vicarious trauma, how to support
Okay.
people who are.
Who are Jorr, are you on the chat? Maybe you can just type it in there.
I think I can just type it. Right? I think I can just type it later on the chat. This will be typed. Yes.
Yeah, if you can just type it in the chat.
There's no worries. There's no worries if you don't get it. There's no worries.
Sorry, whilst I type that question in the chat, I've got another lady in the audience who's got a question.
Sure.
Okay.
Hi, good afternoon. My name is Diana. I'm the chairperson of the New Kane Library and also a PhD student, also a legal practitioner as well, just an expatriate as well. I just want to add a few things onto what you just said and also a few questions as well. Basically, it's very important that we talk about mental health in Gambia. It's important, but what I didn't understand is being in the education sector as well. I've noticed that all the schools so far I've been affiliated with have not mentioned anything about mental health week. So it would have been better if lots of publicity is done, and especially in schools. In Gambia, the problem starts from elementary school, especially the teachers. There are no school in Gambia that can actually tell me there's an SCN regulation in place. I can vouch for that. The jurisdiction I came from, you will not be allowed to open a school if you don't have SCN regulation. If you don't have a nurse who has a very strong background on how to deal with children, with their mental health and centuries, and that has been mentioned by the doctor here. I know it's a stretch in Gambia, but I'd be grateful if the organization, let's just organize this to reach out to the Ministry of Education, basic education, to embed this in our curriculum. It's very important. And also how it can be included in teachers training. Teachers training should have a portfolio where you have awareness of how to deal with mental health, because it's a community where, especially women, they struggle to speak out really. And so when they're going through depression, they just say, you'll deal with it, you'll be fine. But you will never be fine if you don't deal with it. And you will never be fine if you can't talk about it. In other communities, it's a taboo. And especially our religion is actually not helping us. I'm gonna say that. They say you are a Muslim woman, you shouldn't talk about your this, you shouldn't talk about that, you shouldn't talk about that. And I think the organization should stretch out and try to get centers as well, how to get surgeries out to the local public, to the local people out there, like a community outreach. I have people coming to the library asking me, do you have this, do you have that? So we are open for those programs. If anybody wants to come up, dedicate a day of the week, and then we just talk about it. Thank you.
Thank you very much. That's a very strong question and observation as well. I just had someone respond from his name is Augustine. I'll recap the name very soon of his organization. But it says to the lady posing the question with regards to the school, we have approached Ministry of Education since last year, still waiting on them to reply. We can access the school without permission. So I guess what he's saying is they have approached the Ministry of Health with regards to send education or just talking about mental health in the at a grassroots level itself, and they're just still waiting on the ministry to respond. So collaboration, coordination, these are the things that are becoming an obstacle, but it's not like people aren't thinking about it or aren't willing to do it. But Augustine, please type the name again for the organization so that it is stated, because it's quite long, so that's why I can't seem to remember it. But if Dr. Sharif and Dr. Kiran want to add anything to that, please.
I think in terms of approaching schools, and talking about mental health, it's the first step towards early intervention. And early intervention is essential in regards to mental health and recovery. Preventing poor mental health. I think it mentioned that you don't need permission from the Ministry of Education to go to schools and talk about mental health. We can at some point possibly establish guidelines that we can give to teachers. I don't think they have nursing school nurses in the Gambia as such that are attached to schools, but we can perhaps create guidelines that we give to teachers so that there are things that they can look out for in children, i.e. if a child is behaving a certain way, they're becoming a lot more reserved, they're not answering questions, there might be outbursts of anger. I mean, these are safeguardings that you put in place. So I suppose we can introduce these things into schools where people can, just pay close attention to children and see whether there are any changes to their behavior and stuff like that. So I think that's probably one of the first things that we can do in terms of intervening in schools. But it's unfortunately the government in the Gambia. I know they're making some steps towards making things better, but there's still lots of room for improvement.
Okay. Dr. Kiran, did you want to add something?
Yes. So most of the schools over here are private schools that a lot of kids are going to, and the public schools do have some psychologists that go in sometimes to give lectures and speak with the kids about mental health. In the private schools, some of the schools are already in touch with psychologists in the country. Like, for example, Sylvia is in touch with some of the schools. I am in touch with some of the schools. So the schools are taking this seriously and they are reaching out to psychologists themselves now. They are looking for people that can come in and help them with the problems that they are having with the kids. So it's not like we are completely far behind. It's just that we are getting there slowly. Also because they don't even know where to go and who to reach out to, so that becomes a big problem for the schools. So even if they do have a need, they don't really know who can actually meet their needs. For example, there are schools these days that need psychologists that can diagnose and understand the kids that are going through autism, dyslexia, ADHD, learning issues, but they don't have any of the psychologists in the country that are actually willing to diagnose these kids or provide any kind of support. So all of these kids are having to go to Senegal to get their diagnosis done. So also because the country does not have proper guidelines for psychologists, so to avoid any kind of legal issues, psychologists usually stay out of these diagnoses. But schools are reaching out to psychologists for basic mental health curriculums, to have counselors in their facilities for kids to go to speak with, just to have someone that can support them in some way. So it is happening. It's slow, it's very low key, but it's happening.
Okay. And it's great to hear that.
Ravi, can I add something?
Yes, please.
Okay, yeah, just to add to what they said, because we're the ones on the ground. For example, with this event, none of us is making anything from it. We're all doing it voluntarily. So imagine if government actually came and worked with us, because we're ready to just, give all we can for the country. But to be perfectly honest, it's very, very hard to get government support unless you have some kind of funding. But in my experience, all these voluntary events and stuff that we're doing, it's very hard to get government to actually come on board and help us do it. So if there's anyone on the stream or whoever has influence, we're completely open. Give us a call, message us. We're ready to work with you and do this, but at a national scale.
Okay, thank you. Call for action. So the person who responded, as I said earlier, was Augustine, and his organization is the Hope Foundation for Mental Health and Substance Abuse. Hope Foundation for Mental Health and Substance Abuse, and they're listed in the resources in on our website. So Amran, we will share. It's in the pamphlet, but we'll also share the address afterwards for everyone. The final question that I have before we go on to this one for the mental health first aiders, someone sent, people see Tanka Tanka as a place that makes people worse because of the drugs they give them there. As a result, they don't like coming or bringing people to Tanka Tanka. How is Tanka Tanka or the Ministry of Health working to overcome this misconception? So they're saying that, and I've actually heard this before, they don't like taking people to Tanka Tanka because they believe that when they get there, they become more ill because of whatever drugs that they give them there. So they're saying, as a result, what is Tanka Tanka or the Ministry of Health doing to overcome this misconception? Does anyone know?
Do we have any people in the audience, Jorr, who might be able to
So that
respond?
can you hear me?
Dr. Kira,
Can you hear me?
any thoughts?
Yes, we can hear you. It's very faint, but we can hear you.
Okay. It's true that from my experience and from what I've been hearing around, people that do end up sending their patients or their family members to, or generally people that go to Tanka Tanka usually get worse because they only administer one specific medication to everybody, regardless of what their problems are, what their disorder or their illness is. So, and there is no proper psychiatrists or the psychiatric nurses over there also are not very highly trained to deal with psychiatric patients. So it is true that people that usually go to Taka Taka don't do as well as they should be since they're going to get help. The ministry I heard is working on it, but I haven't really seen or heard anything recently. But yes, I've heard that they are working on it getting better. But as of like any recent times, no, I haven't really heard anything that has been going on in Tanka Tanka. It's still the same. People are still scared to send their patients or their family members and friends over there.
It's
Yeah.
quite sad though, being the
All right,
only
thank you. Thank you.
psychiatric hospital in the country, for people to be scared to send patients there. That is quite sad.
Can I just say that it's not just in the Gambia. I think it's worldwide. When it comes to medication, medication. I mean, antipsychotics. It's not an exact science.
Hmm.
The belief is that it kind of antidepressants works on your serotonin neurotransmitters. It increases your serotonin levels. It makes you feel happier. It makes you feel make you feel better. You regain a sense of satisfaction and interest and motivation. Um, Psychotics, it increases your dopamine levels. That's the belief. And what happens is, sorry, it decreases your dopamine levels. And what happens is, if you're having a psychotic episode, for example, experiencing hallucinations, i.e., it could be olfactory, which is smelling unusual things or tasting unusual things. It could be auditory, hearing things, visual, seeing things, tactile, feeling things. What it does is it brings down the dopamine levels, and then what should happen is those symptoms subside. Now, depending on how soon you get this medication, and depending on your history, sometimes the symptoms can stop altogether. Sometimes it just reduces the intensity. It doesn't cure you altogether. It just reduces the intensity. In the UK, what we do is we give you as much information about the medication. We tell you about the medication. We talk about the side effects openly. Say, look, these are the associated side effects, but there is medication that will help with these side effects. You know, there's certain myths about medication. We try and address those myths as well. So if there was some sort of a program in Gambia that perhaps Tanka Tanka could start talking about medication and just educating people about the medication, why it's being used, what it does, how it works, the side effects, how long the side effects will last for, and what can be done about them, and just lifestyle changes, then it might make a difference. It's about education. But ultimately, antipsychotics and antidepressants work in conjunction with therapy, with psychological input. There's strong evidence-based, research to suggest that, in conjunction with medication and therapy, people get better. So it's about education.
Yeah, yeah.
Okay, thank you very much. I just want to say quickly, Amran, this is Usman here. I just want to step in because this is first-hand experience, and I happened last month or previous month in March. I won't be emotional, right? Because I lost my nephew. He had mental challenge, and then we didn't know where to take him. We were at the Royal Victoria Teaching Hospital, and then we were referred to Tanka Tanka, right? But
Have you lost the sound?
Yeah, I think so. And it's frozen. Jorr, can she hear us? I hope they haven't lost it.
so I haven't had anyone mention traditional healers here. What happened is, I'll keep it in short or in summary. So we took him somewhere where, he was supposed to be treated. Like they were saying,
Jorr, you keep cutting out. Can you guys hear us? No? Okay, I have a comment, Ravi. Can I just do that until they come
Yeah,
back?
go ahead. Yeah.
Okay, so she said she's watching. So she's saying the reason that a lot of people don't get help is because a lot of people just do not believe that Western medicine will or can
can you
cure
hear me?
mental disorders. Yes, Os.
Sorry, we lost you
Yeah,
for a bit.
okay.
Yes, you can finish. Then we'll do this one. Yeah.
Yeah, okay. So what happened is, the healer decided that we should leave him with my nephew in order for him to do his job. So that was the mistake we did. So everyone left and we left him with him there. So nobody knows what happened. That was on Thursdays, Friday, Saturday, then Sunday. He called and said that the boy passed away. So we couldn't understand or we couldn't get it, you know. So this is one thing that needs to be looked into, like how they treating these people with mental challenges. He was chained. When we were with there and we observed the body, he was chained. You can see the marks on his hands. So the guy couldn't explain still what transpired. No family member was there. So we only have to take what he said, that the boy simply passed away like that. You know, Sometimes they are beaten for sure. They are beaten and they are chained. We have pictures and
Yeah.
evidences of that. They are chained and maltreated. So in short, we need to look into how these traditional healers conduct their practice. That needs to be looked into. And this wasn't the first time. And the reason why I mentioned this is to do justice to my nephew and say this because the family didn't want to take up the matter, so they just leave it at that. So, but to do justice to him, I have to make it clear, loud and clear, so everybody knows and be aware or take care of if they take their relatives to these traditional healers. someone has to be there or monitor what they're doing to them. Thank you.
Ravi, in fact, the
Honestly, the
person who,
food.
oh, that was very hard to hear, and I'm really sorry
Yeah, that
to
was
hear
hard
that.
to hear.
And what's even more terrible is that we have so many of these stories where people go to Tanka Tanka and then they end up coming out even worse that they went in. I also have family that went through that. So yeah. And then Mr. Sheriff, you mentioned the medicine. So I think one thing people need to understand is that unlike physical ailments where you just get one medicine and you're on it until you feel better, with bipolar and these mental illnesses, they're constantly, because they don't really understand exactly how it works 100%, so they're constantly having to play with the meds that you take. So for
Yeah,
The
example,
doses.
I've been on like 5 different meds over the years.
yeah,
So
yeah,
some work, some won't work, so they just
yeah,
kept experimenting.
yeah,
Now the
yeah.
person who sent a private comment, basically they're related to what Ose was talking about. So they're saying the reason is just sometimes people just don't believe that Western medicine can or will cure mental disorders. So
Hmm.
they would rather go to the marabouts and
Hmm.
syrians.
Hmm.
So she thinks we need to get folks off that thinking and have them embrace the healing power of Western medicine. But just to do a quick one on that, I think people set it up as an opposition. Either you're going to the syringe or you go to the Western medicine, but you can mix it up. You can go to the syringe, so but dollars a hell, you can feel better, and you also take that because faith and stuff. Yeah, they're definitely important,
Hmm. Hmm.
but they have their place. So I think a mix of the two. But I'll let Doctor and Mr. Sheriff go through that. Can you hear us?
Okay, sorry, Amran. We really struggled. We didn't hear a word of what was said
Oh,
because your
okay. So
voice was really muffled.
can you hear me now?
We can hear you, but it's not clear. It sounds very, very muffled, like you've got something over your mic.
Ravi, can you guys hear
I
me
can
fine?
hear you loud and
Yeah,
clear.
yeah, I can
Yeah.
hear
Yeah,
you. I can.
yeah.
Let's
So,
try that
so,
again.
so, Amran, perhaps, if I start, I mean,
Yeah, before
do
the.
I sound any better at all?
No, you sound good. We can hear
Okay,
you
Yeah,
fine.
okay. So,
Mr. Jallo, your Mr. Jallo, your voice is a lot clearer. And just
okay,
sorry to
okay.
interrupt you. I've got a guy that's been standing next to me for at least 20 minutes trying to ask a question.
Oh
Hold
yeah,
your thought there, Mr. Jallo. Can you just ask his
give him.
question and then we can come back to you? I'm really sorry, but he's just been standing here for a while.
Good afternoon, everyone. My name is Ceesay from the University of the Gambia Medical School. So my question is for Dr. Kira. So I wanted to know if there are any lead advancement in the diagnosis and treatment of mental illness in the Gambia.
Are there any?
Whether there are any late development or advancement in the
Yeah,
diagnosis and treatment of mental illness in the Gambia.
there are.
Yeah, and the next question is for Prof. Sorry. My question is, what are the small things in daily life that can hurt our mental health without us even realizing it? Prof. Can you tell me how is going?
I believe he's asking what can hurt our mental health without us realizing. That was the second one. And the first one I
Yes,
couldn't really hear well.
the first
Yeah.
question was for Dr. Kira.
Oh,
Yeah,
for
I
Dr.
asked,
Kieran.
yeah. So the second question was for Professor Khan. Yeah, yeah, Professor Jala, yeah. Yeah, the
Professor
question
Jallo.
is, yes,
Professor.
I'm getting promoting as we go along.
Yeah, way
You
more
know what?
titles.
We have to do this more often. It's really good for for my ego.
What?
What was the question for me?
yeah, the question was, what are the small things in daily life that can hurt our mental health without us even realizing it?
That's I mean that's a good question. I mean it's we as individuals we all have a different level of resilience. You know, what can have an impact on your mental health will be different for somebody else. We all know that the first thing we talk about poverty. Poverty has an impact on our mental health. not being able to look after your family, look after yourself, eat adequate food, that can have an impact on your mental health. In the Western world, we talk about sexuality. There's a lot of issues now with transgender this, transgender that, homosexuality, being ostracized, stigmatized. You know, a sense of not belonging that can have an impact on your mental health. Um, we could talk about bereavement. I mean, a mother can lose her child, and that can have an impact on her mental health. Yeah. There's more and more research around women and their menstrual cycle in relation to their hormones. So there's quite a few women that I've come across. Once they have their menstrual, every time they have a menstrual cycle, it has an impact on their mental health. So it's varied and far in between. Um, I think in terms of a younger generation, it's more about substances. At the moment, it's about substances. People that are smoking cannabis, and bear in mind that now the cannabis that I remember when I was younger is very different from what they have now. It's a lot stronger. So the cannabis that they have now, the levels of THC are a lot stronger than the cannabis that they had back in the day. You smoke cannabis, it lasts longer, and you're more than likely to have a psychotic experience. So it's there's different things. There's psychoeconomic reasons. It depends on the level of resilience. And I think in terms of recovering, it is about resilience as well. It's about learning to cope with certain stresses in life, certain challenges in life. That has a major impact on our mental health.
Very true. It seems like we're
Running out of
taking a
time.
bit too long. Yeah, running out of
Yes.
time. If Dr. Kiran just wants to add one last thing, and Jorr, we start to wrap up, please.
To answer this question, the therapists and psychologists in the country usually do end up diagnosing for any of the patients that they see. But also it depends on the case and the capabilities of the therapist as well. But yes, usually for the difficulties that the people do go with, the psychologists and therapists, the counselors in the country are able to diagnose and provide the required help for the disorders and the illnesses and the difficulties. So it's not very difficult to get diagnosed in the country. The difficulty is only coming for the issues with the kids, ADHD, autism, and dyslexia, etc. It's only for those kids difficulties with diagnosis, but everything else, um, if the therapist, if the psychologist is comfortable and capable, they're able to do the diagnosis, yes.
Uh,
Uh,
Rabia, I
thank
just
you.
have a quick one that I think is important.
Yes.
Yeah, someone sent, does the organization consider the rural-urban access disparity, considering that many Backway youth come from rural settings and their parents often deal with the trauma of their situations, many times leading to depression? So organizations like Fantanka have initiated lay counseling as a means to support basic local capacity. Can they help these initiatives by providing TOTs for organizations on the ground and in localities? I guess that's directed at Dr. Kira.
Dr. Kiran, yes.
Yeah.
Dr. Kiran, did you hear the question?
No.
No, I couldn't hear the
Yeah, just
question,
can you
or
hear me?
so maybe Rabia can actually say it because you can hear you more clearly than you can hear
Okay,
me.
yeah, Ravi, if you can summarize it for them.
Can you repeat it again, Amran? It was to do with the urban and rural disparity because
Yes.
a lot of the youth that go
Backway,
back
yeah.
way are usually from the rural areas. So what exactly again, Amran?
Yeah, so what are we doing to close that gap basically?
Yes, what is being done to close that gap, basically? The unhappiness that people are feeling.
No, we couldn't hear the question. It was very muffled. Maybe you can you can type it so we can read it.
You can't hear Rabi either.
Amran, can you put it in the chat?
Okay.
Even Rabia is more clearer than
Yeah,
Amran. I don't know why.
It's women's voices have more power. That's just it. So Amran says, how do we fix the disparity between urban and rural patients? How do we fix the
Okay, how,
disparity between urban and rural patients, especially when it comes to the backway boys?
These are people that get into the Western world via a legal way.
Mostly it's the mothers that are here due to the trauma.
Okay. Okay.
so the big issue is that even with the urban patients in Gambia, there's not much that can be done for them even because there's only one psychiatric hospital that is Tanka Tanka and people usually don't prefer going there. For the urban patients, it's better for them to seek out private psychologists or visit the Canifing hospital. And also with the rural patients, they get help when people do go out in groups to these rural areas to give out lectures or meet with them, hold group sessions. But otherwise, if they do need any kind of treatment or help or consultations, they need to come to the city because that is where all the psychologists and the psychiatrists and the psychiatric nurses basically are. If they do believe in the traditional medicine and they feel like that is the way for them, then there are traditional healers in the rural areas that they may trust and want to consult with. But if they are looking for a more medical way of doing things, then majority of the help is in the urban areas, and even that is very limited. So unless they find the right people or find the right connections there.
Okay, thank you. Um, as we were saying, this is a conversation that would never end. We could go on and on for the rest of the evening, but this is the very first, and there'll be more to follow. We would like to say thank you to people who have honored our invitations, such as Augustine, who's on the call, and Mary Tal for Hemda, Tanka Tanka, anyone who has sent out a representative there or anyone who has joined the call online. We're just saying a huge thank you to you. We're encouraging everyone in the audience here and online, well, there and online, to just check in with your family, your friends, and your neighbors. Support begins with conversation, support begins with care, and that mental health is a shared responsibility. It's not a personal failing. So if it affects everyone, if your cousin has mental health problems, it's going to affect the whole family. If your neighbor has mental health illness, it's going to affect the entire neighborhood. So that's why it's a shared responsibility to just check in with everyone. Most importantly, the pamphlets would be shared out to those who are there, but all of that material is also on our website. Amran would tell us the exact address of the website itself. We also have a Facebook page, and I am also on TikTok on This Little Life of Mine. That's what my TikTok handle is called, This Little Life of Mine, and it's all about mental health. It's also about Wolof and just getting the word out there on how to care for yourself so that you don't find yourself suffering. But Amran,
Yeah.
anybody else want to add a few things, and then we can call it a
Yeah.
day?
Her TikTok is nice, much as I hate to say this. So you should follow her. You know, she makes like she teaches
It
people in a
wouldn't be
very
you if you didn't
fun
add
and
that there.
engaging
Anyway.
manner. Okay, so someone asked what to take away from this, and is there anything they can do to participate basically and help out in this endeavor. So I'll just give them a quick thing, and then I think we'll step through, and everyone can also give them their call to action after this, and then we can start closing up. So on our side, like Ravi said, we'll share the website. But this pamphlet that we have created, it's actually a summary of everything we have covered in the week, and it also contains our website. So one quick thing you can do is take that pamphlet home, share it with as many people as possible, so they understand these different illnesses, and then commit to having a conversation with someone who's a sufferer. So you can tell them about it, and then commit to having a conversation with friends and family, so you can also tell them about it. So I think if you just start with that, we'll have a ripple effect all up and down the country, and that alone is a huge thing. So I think from my point of view, that's one thing that you can take away. For the website, let me find it. I'll read it at the end, Rabi. So I think we can continue.
All right, Jorr.
Yeah. Sorry, guys. Can you all hear me?
Yes, we
Yes,
can.
just closing.
Yeah. Um, Amran, I thought we were the ones in the third world country with the not so great internet, but your internet is terrible. We can hear
Oh,
everyone
it's my
else, but
headphone.
you
Really? Was that necessary? You can just say your thing.
can't. We can't. Everything that you say is just a muffle. Like no matter how long
Yeah,
you speak for.
I think
Yeah.
it's my headphone. Sorry.
Um, I'm actually just as a closing remark. I'm actually pretty pleased and really happy because, believe it or not, we still have a lot of questions. Unfortunately, due to time constraints, we will not be able to answer all the questions, but we will be available offline. Our phone numbers are available, our email addresses, our website, and our Facebook page is available. If you do have a question and that you need an answer to, we'll see the best way that we can help you. Please send it to us. Anyone that's live, you can take my phone number afterwards, and I'll obviously share the questions with the experts. Yeah, just thank you very much to everyone that's attended. I'm not sure whether you guys can see the audience, but we did have a really good turnout. Especially, we had like a lot of students come in, a lot of students attended, and they seem to have a lot of interest in what we're sharing. I'm actually pretty happy that people have a lot of questions and people are willing to learn about it and they want to know more about it. So hopefully, there's just like just the beginning of greater things that we're about to do for mental health in Gambia. Hopefully, in 10 years' time, every one or two people that you ask will be able to direct you to the right person that will be able to help. And please remember, people, you need to speak out. Even though, I mean, we might not have all the facilities that we need out here, but please speak out because it definitely helps. Thank you very much for your time and for everyone that attended. And I'll pass it over to one of the other guys to go ahead.
Yeah. So just for the, can you guys hear me? I'm yelling. Yes.
Mhm. Yes, we can hear you.
We can hear you.
Okay, so the website, I don't know. Can you guys put it up on the screen? I think that might be faster for people, better for people. But the address is gam-mental-health dot vercel vercel dot app. So let's see if they can put it up on the screen. But if not, the pamphlets that you will be handed have the website on the front page, so you can just visit it from there directly. Back to you, Ravi.
No, that's all from us
From
here.
you, okay.
Yeah,
I
that's
guess Uncle
completely.
Malcolm to close.
Yes, and we want to just say a huge thanks to Dr. Jallo for his expertise that he has shared
Dr. By
here.
Force.
Yes, Dr.
Dr.
Byforce,
Byforce.
honorary title that we have given to you.
Thank you
And
very
we
much.
look forward
Appreciate it.
to having you here again and to chat as well. We appreciate the fact that you have come and given us a different perspective onto what mental health can be. And I'm just telling everyone, please follow our Facebook page, and Jor will give you the details on ground. And thank you to Alcamba Times. Thank you to Muso Media. Thank you to everyone who has made this first time event a success. Amran, you were saying?
Anytime.
Yeah, so yeah, just what you said. Thank you all. Thanks for coming. We didn't expect this kind of turnout, but it's very encouraging. So we'll see you again next year. We'll just make this an annual thing. And we'll also be having a lot of other activities. So follow us and we'll share those.
All right. Thank
Okay,
you.
thanks everybody. I think we have thanked everybody that was supposed to have thanked. Thanks to all those that attended online. Thanks to, of course, our various panelists, and specifically, we have a number of elderly states, women and statesmen in the house. So I think they deserve to be thanked as well as students. And of course, thanks to Bakari for always, I mean, being very receptive to having us organize such events. Rabia, Professor Jallo, Dr. Tania, Dr. Amrani, Fatumata, we say a big thank you to each and every one of you. Of course, this is a discussion we will have to continue because the interest that has been shown both online and in-house, I mean, is tremendous and it's very encouraging. Now, as I'm getting close to being a senior citizen, I will still be available, of course, whenever I'm needed to help push it. So, and once again, thanks to everybody. Rabia, do we have a group photo or?
Yeah.
It's okay. All right. Once again, thanks everybody and goodbye, good night. Good evening.
All right. Thank
Thank
you.
you.
Yeah.
Okay.
Okay, hold on. You can end the stream. Thank you.